So every year in major meetings, we have an update follow-up of GSR. And GSR is very important for us because it tells us what is the efficacy and safety of renal denervation outside of the rigorous controlled trials, which usually have more strict inclusion criteria. And in GSR, we can really see a picture of what is being done worldwide treating patients with renal denervation. So it tells us a lot about efficacy in different patient profiles. There's a significant number of patients being followed up. As I said, almost 3,000 patients. And this follow-up is extended until 3 years. So we can say much about efficacy, about long-term follow-up, and also which subgroups of patients might have better response to renal denervation. And we saw in GSR that renal denervation works independent of age, independent of diabetic status. It even works in patients with chronic kidney disease because there's a subset of patients included in GSR with chronic kidney disease, and also in isolated systolic hypertension, which is also an interesting subgroup that has been captured in a large registry like GSR. So with data from GSR now reaching almost 3,000 patients, we can see there's a significant drop in blood pressure, not only in office blood pressure, but also in 24 hours ABPM, which we all consider as a more robust marker of blood pressure control. And we see this at least with the 3 years follow-up, which is quite important and reassuring of the sustained effect of renal denervation. And this, from this cohort of almost 3,000 patients, the last 500 were treated with a new spiral system. And in those patients, the reduction in blood pressure was very similar to the patients that we treated with the previous system. And this regarding not only efficacy, but also safety, which is still remarkable, the safety of renal denervation in terms of the incidence, for instance, of renal artery stenosis, which is a very rare complication. And so this points out the remarkable safety of renal denervation. In the randomized controlled trials of renal denervation, usually patients with chronic kidney disease were excluded. But in GSR, because this reflects our real-world practice in several countries, some patients were included with chronic kidney disease. And so this GSR is a good opportunity to see those patients, to follow up those patients, to see what happened to renal function, because we might be afraid in the beginning that by treating these patients with renal denervation, we could see a more significant decline in renal function. But that really doesn't happen when we compare the rate of decline in renal function for patients with or without chronic kidney disease. That is really not different. And of course, for these patients, we can expect a drop in renal function over time. As we age, our renal function doesn't stay the same, especially if we have hypertension, if we have diabetes, if we are above a certain age. We are expected to have a decline in our renal function, but it's quite reassuring that this small decline is not different for patients with or without chronic kidney disease. We started treating patients with renal denervation back in 2011, and we still follow up all patients that we did. So I still remember the first cases that we did, and those patients, during the follow-up, we saw not only the reduction in blood pressure, but also, and I think that is more important even than blood pressure, we saw some reduction in target organ damage, evaluated both with echocardiogram I'm talking about left ventricle mass, and also in proteinuria, which is also a very well recognized marker of target organ damage related to hypertension. This is like a case report, but to go beyond this individual case, we decided also to collect that data for all our patients that we treat with renal denervation. So we now have data for all our patients that have at least 1 year follow-up. And we saw reductions and published that in two different manuscripts, not only in reduction in LV mass, but also a reduction in proteinuria, which are two well-recognized markers of target organ damage. So earlier this year, we saw in ACC the presentation of the pivotal trial, which was very important, not only because it proves once again that renal denervation works, and this study was done out of the confounding factor of medication. There's really a true biological effect of renal denervation, and that has been well demonstrated in a trial with a significant number of patients. But also it starts the discussion about what is the best candidate for renal denervation, because it might not just be the patients that we were treating back in the earlier days, the patients with very high blood pressure values taking 3-4 medication, but a new subset of patients that are not taking medication because of preference or because they have side effects. So those patients might also be good candidates for renal denervation. And now we have a trial that proves that renal denervation works in that patient subset.